Welcome to Mentoring Soft Contact Lens Care and Handling. Proper care and handling is essential to the long-term success of all contact lens wearers. Studies show that about half of the contact lens wearers are non-compliant in some aspect of care and handling. Our best opportunity to improve compliance is through proper instruction. Opticians new to this activity require comprehensive training before providing instruction to new patients. The mentoring process involves guided practice between a mentor or coach and a less experienced learner. The 5 key elements of the mentoring process are modeling, coaching or scaffolding, reflection, articulation, and exploration. The mentee should be provided with a script or checklist of the sequence of important items to be presented. The mentee can follow along while the mentor models or demonstrates the process. Key areas to cover include hygiene, cosmetics, solutions, lens handling, lens cleaning, rinsing and disinfection, activities to avoid while wearing contact lenses, warning signs, and the need for follow-up care. Today, Lisa, we're going to go over how you would go about teaching someone how to care, insert, and remove their soft contact lenses.
Okay.
And Adriana has volunteered to serve in our little role-playing exercise so you can get comfortable with the procedure. And the best way to really learn how to do this is to, first of all, watch me instruct her on how to insert, remove, and care for the lenses. Then I'll give you an opportunity and I'll be here to coach you along. I've prepared an outline of all the important steps that we need to cover today when we're instructing the patient. And you don't necessarily need to memorize the script. However, you want to refer to this to make sure all the important points are covered while you're working with the patient.
Okay.
And as you evolve and get more comfortable with it, you'll find your own order of presenting these items.
Okay.
Okay? So I'll let you review this while I go through the process. And certainly the first process is to talk about hygiene. Very important that your hands are perfectly clean when you go to handle your lenses. Also that your nails are short, they look great and clean. And when you go to wash your hands, a couple things you want to remember. First of all, when you select your soap, make sure you select a soap that's free of any kind of fragrances or lotions because that material will transfer the lens and will cause irritation to your eye. When you're washing your hands, make sure that you rub them sufficiently. Some people say Mary had a little lamb 3 times to themselves while they're rubbing, and that's about the right amount of time. Rinse them thoroughly, and you're ready to go. Okay. Now, when it comes to makeup, you want to put that on after you've inserted your contact lenses. And speaking of cosmetics, when you go to buy your cosmetics, you want to make sure that, first of all, look for things that are hypoallergenic. Also, look for products that are water soluble. You want to avoid waterproof makeup because if that breaks off and gets underneath your contact lens, it won't dissolve and will cause irritation.
Okay.
Also, avoid any extender mascara, glittery eyeshadow, and products like that. All right, are you ready?
I'm ready.
All right, well, what we'll do is now we will identify which is your right lens and which is your left lens. And when you take your lenses home, the boxes will be marked. And I would recommend that you always start with your right lens first. If you put your right lens in first, take your right lens out first, you'll be less likely to get them switched.
Okay.
All right, let's start by opening the right lens. But to do that, we need to have a lens care system. Now, we actually use 3 different products based on the patient. And in this case today, we're going to demonstrate the BioTrue system from Bausch & Lomb. So we'll set these off to the side, Lisa.
Okay.
And even though they're similar and they represent the latest generation products, there are some differences. So you want to make sure you're familiar with all the different steps for the product that you're dispensing.
Okay.
So let's open it up and see what we have. Okay, get the case. All right, so this is the solution that you're going to use to care for your lenses. It's a multi-purpose solution that you use for rinsing, cleaning, and disinfecting. Right now, for the insertion of the lenses, we may need it for rinsing. when you go to open your lens, these little blister packs, give them a little shake to make sure the lens is floating in there. And there's a little arrow on the packet that shows which end to peel up to open the case. Would you like to try that?
Sure.
And then you can take the ball of your index finger and put it into the case, and the lens will come right out with it. Terrific. Now, before we insert the lens, we want to make sure the lens is free of any kind of damage or debris. So you want to, with your glasses on, carefully inspect it to make sure that there's no chips or nicks on the edges, no foreign particles on the lens. And we also need to inspect to make sure the lens is not inside out. And two ways we can tell that. If you hold the lens up, you'll be able to see if it's in its proper form, that it's a nice deep bowl-shaped appearance. If you look at it and the edges flare away like a saucer, then you know that the lens is inside out.
Okay.
See the difference?
Yeah.
Now, in some prescriptions it's very hard to tell. So if you're unsure, a second way you can confirm if it's inside out or not is to place it on this crease in your hand right here and just gently flex the lens. And if the edges curl toward themselves like a taco, then you know it's in the proper form. If they roll back against your hand, then you know the lens is inside out.
That makes sense.
All right. Now we've been handling a little bit, so it's probably a little bit dry. So I'm just going to give it a light rinse with the solution. And we want to put this on the tip of your index finger. Okay. And we don't want too much moisture, because if there's more moisture on your finger than on the lens, it's going to stay in your finger as opposed to going into your eye. And for inserting the lenses, it's helpful, particularly for a new wearer, to use a mirror. So I'm going to bring the mirror over.
Okay.
And what you're going to want to do is take your glasses off now. And with your left hand, come over the top, get underneath your upper lashes, get a good grip. And with your middle finger, pull your lower lid down. And look in the mirror, and you're going to place the lens directly on your cornea, right on the front part of your eye. All right, slowly bring your finger away. Roll your eye a little bit. That'll get some bubbles out. Release the lower lid first. Look down and slowly release the upper lid. Terrific. And if you feel like there's still some bubbles, you can close your eye and just pat the lids. Never rub the lids, but you can pat a little bit, and that will also help to get the lens to settle down.
Okay.
Good, you did that very well.
Feels good.
All right. Now the other part is the removal of the lenses. But before we get to that, each day when you go to put your lenses in, you want to ask yourself 3 questions. The easiest way to remember it is just to remember: look good, feel good, see good. By look good, what we mean is you want to look in the mirror each morning and look and see, is there any excessive redness? Is there any discharge? And my eyes look different than they did the day before. By feel good is after you've inserted the lens, it should feel as good as it did the day before. And by see good, before you ever get up from the table, always take the time to cover each eye separately and make sure you can see before you get up.
Okay.
All right, good. Well, let's go ahead and put the other lens in.
All right.
Okay, good. Looks like it's in its proper form. Okay, so same process. Again, left hand up underneath the upper lashes, get a good grip. Middle finger, pull the lower lid down, and bring the lens, place it directly on the center of your eye. Okay, slowly release your finger, roll your eye a little bit, look down, release your lower lid, and slowly release your upper lid. Terrific. Did a great job. Okay, now we'll talk a little bit about removing and caring for your lenses. So the first step in removal is, oh, by the way, I meant to say, when you put your lenses in the morning, the case will be filled with used solution. So in the morning, what you're going to want to do is dump your case out, take your solution, rinse it out, dump it out. Leave the caps off and let the case air dry. That way it won't support the growth of any microorganisms in your case.
Okay.
So that means at nighttime when you get home, the case will be open, it'll be dry, and the caps will be off. You're going to take your multi-purpose solution, fill the cases about 2/3 full with solution. And naturally wash your hands thoroughly like you did when you inserted them. Again, get over a table, spread a lint-free towel out in front of you, and now we'll be ready to remove the right lens. To remove that, we're not going to use the mirror for removal, and you only need a single hand. And what you're going to do is you're going to look up at the ceiling, take your middle finger, pull your lower lid down, reach up, slide the lens down onto the lower part of your eye. While you're still looking up, come up with your thumb and flex the lens between your fingers.
Okay. Am I ready to try?
You're ready.
All right. Let's see.
Okay. So look up, reach up with your index finger, grab the bottom edge of the lens, slide it down, hold it, and come up with your thumb and flex the lens between your index finger and thumb. Terrific. There it is. Okay. Once the lens is removed, we need to clean the lens prior to disinfection. So what I want you to do is to take the solution and put 3 to 5 drops in the palm of your hand. Place the lens in there, put another 3 to 5 drops on top. Great. And now you're going to rub the lens in a back and forth motion, never in a circular motion because that could damage the lens. Just straight back and forth for 10 seconds. And then you're going to flip it over and do the same thing for 10 seconds on the other side.
Okay.
And once you've thoroughly rubbed the lens on 10 seconds on each side, then while it's still sitting in the palm of your hand, just take and squirt the lens for about 5 seconds.
Okay.
All right, to rinse it thoroughly. You can dump out the excess, and then you're ready to place the lens in the case. Good.
Okay.
Okay, and when you put it in the case, make sure you can see it in the case. The lenses have a light blue handling tint, so you should be able to see the lens in the case. The green represents the right lens, so always put that on before you move on to the left lens so you don't get them switched. Okay, let's see how you do with the left lens.
All right. Hold down the lower lid.
All right, reach up, slide it straight down, hold it, come up with your thumb and flex the lens between your fingers. Good. Okay, and repeat the cleaning process.
So, what am I gonna do? Okay.
You know, and this rubbing and cleaning is a very important part of the process. Just by rubbing and rinsing the lens, you remove about 90% of the microorganisms on the lens. So it's much easier for the solution to properly disinfect it.
Okay.
All right, good job.
Okay.
Okay, good. Well, it appears that you're very comfortable handling the lenses, so I think we can get you started on a wearing schedule today. And we're going to have you wear the lenses for a total of 4 hours today. You're going to add 2 hours a day up to 8 hours. You'll come in, we'll schedule an appointment for 1 week from today. And when you come in for that appointment, you want to remember a few things. First of all, you want to remember to bring your contact lens case and solution with you. Bring your prescription glasses with you, and make sure you've had the lenses on for at least 4 hours when you come in for your appointment.
Okay.
Now, the wearing schedule is what most people find comfortable. It's not an endurance schedule, though. If you find discomfort, certainly don't put yourself at harm to get to the number of hours. There's four things that you really want to keep in mind should they occur. And that would be pain, redness, decreased vision, or increased light sensitivity. If you encounter any of those four symptoms, you need to take your lenses out and call the office. If you can't reach anybody, then you need to seek medical attention.
Okay.
Is there any questions that you have?
No, I think you covered most of all of it.
Terrific. Well, enjoy your lenses, and we'll look forward to seeing you next week.
Awesome. Thank you so much.
Coaching or scaffolding involves providing the mentee with verbal support of the cognitive activities needed to perform a competency. The mentor will now allow the mentee to instruct the patient on the care and handling of soft contact lenses. It is best to begin with role-playing, where the mentee is instructing a coworker. If necessary, the mentor will correct the information or techniques the mentee is providing to the patient. Okay, Lisa, you had a chance to watch me teach her how to insert, remove, and care for the lenses. And as you followed along the guideline here, was there any questions you had on anything?
No.
Okay, great. Well, then what I'd like to do is to have you now go ahead and go through the process, and I'll watch and provide any assistance that's needed.
Okay. Okay, so what we're going to do today is teach you how to insert and remove your lenses. What we always want to make sure we start out with first is making sure that you wash your hands with a perfume-free soap. Make sure you wash them for how long?
That's okay. Yeah, I know. Some people say happy birthday. Some people say Mary have a little lamb. Whatever works for you, but you want an adequate amount of rubbing and rinsing. That's
okay.
good. Yeah.
And then and also dry them with a lint-free cloth or towel. Okay. So next we're going to wait.
It's okay. This is why we're role playing, because that way you're going to feel much more comfortable when you start working with a regular patient.
Okay. Okay. So okay. Wait. Because I'm thrown off.
Yeah. No.
You know what I mean?
Sure. That's fine.
Okay.
All right. So we talked about hygiene.
We talked about
You know,
hygiene,
so now we're ready to insert the right lens. And now we can start with a blister pack lens if you feel more comfortable and go through the process. So I think we have a lens right there that we can use.
Okay.
So go ahead.
Okay. So first let me tell you about makeup, and before you insert your lenses, you want to make sure that you have no makeup on your eyes. Any type of hairsprays or anything like that before inserting your lenses. And you want to make sure that you use hypoallergenic or water soluble makeup, and no makeup with glitter and different things like that, and extended eyewear. Okay. What you're going to do is take your right lens first. You always want to start with your right lens, and you want to have the arrow. There's an arrow here on the contact lens packet. And have it go away, pointing away from you, and you want to shake it to make sure the contact lens is loose in there. And then you just open it up like this. Okay? All right, perfect. So,
you can have her take it out of the case.
okay.
Yeah.
Or in this case, because we're role playing, if you want, we can use the lenses that we just used that are in the case.
Okay.
Because they're fine to work.
Okay, perfect. So why don't we do that then? Okay, so what you're going to do is, of course, start with the green on this particular case is the right lens. So you're just going to take the lid off, and then you're going to take the lens out of the solution. Okay, and then by putting it on your finger like that, if it's shaped in a bowl, then that tells you that the lens is inside on the right side. Okay, you can flip it over, and then you can see how it kind of it's not in a bowl shape, like it's like going flaring out. Then that lets you know that it's inside out. Okay. And another way you can check to make sure that the lens is inside, it's on the right side, is put it in the crease of your palm of your hand. And if it flares out, then that tells you that the lens is also inside out. Okay.
Okay. One of the things that I would also do is introduce the solution early on.
Okay.
Not a lot of information on it because they're not listening to too much until they actually get the lenses in their
Okay.
eyes. But say that this is BioTrue, this is the multi-purpose solution you'll use for rinsing and cleaning and disinfecting. We've selected this solution for your lenses in your eyes. This is the only solution you should use unless you call the office first.
Okay.
Okay, but for now, we're just going to may need it for rinsing before she inserts.
Okay, so with the BioTrue is what you're going to use to rinse and clean your lenses with, and also it'll be the solution that you'll put in your cases to store the lens when they're not in use. Okay, so what you're going to do is use the solution, put drops in your palm of your hand, with the lens in the palm of your hand. There you go, 3 to 5 drops.
Okay, yeah, she really won't have to clean it right now. Because
we just took out the
right,
packet.
we're just going to go ahead
Okay.
and put it in her eye.
Okay.
So,
So go ahead, grab your mirror, okay? And then you're going to take your left, or well, your left hand and pull up the upper lid, and then take your index finger and pull down the lower lid, and then you're going to insert the contact lens in your eye. Yeah, there you go. And then you're going to let the lower lid go, then look down, and then let the upper lid, and then blink. And if you feel like there's air bubbles, then you can kind of like pat the eye just a little bit for the lens to settle.
one of the things you might do when you are showing her how to insert it is to take your glasses off so she gets a better look of you pulling the lids and so forth.
Oh, okay.
Okay, good job. All right, I think we can dispense with putting in the left lens. We'll just have you go through having her now talk about the 3 questions she should ask herself.
Okay, the 3 questions you should ask yourself once you insert your lenses. Do they feel good? Do they look good? And can you see good out of your lenses? Okay. You could cover one eye and see how well you see, and then cover the other one to see how well you see out of the lenses.
Okay.
Okay.
Okay, let's go ahead and talk to her about the removal and lens care part of it.
Okay. When removing your lenses, you won't need the mirror to remove your lenses. And what you're going to do is take your index finger and look up, and then pull the bottom of the lens down and pinch it out with your index and thumb.
Okay, good instructions, but I prefer to use the word flex because pinch sometimes
Flex out,
because
okay.
we really do want them reaching edge to edge and flexing as opposed to reaching in there pinching it where they might pinch it too hard.
Pinch it too hard. Okay,
Yeah.
so flexing out. Okay.
All right. So I'm gonna take my finger. I'm gonna pull down my
Lower
lower lid.
lid, look up, and then slide down the contact lens, and then flex out with your thumb and index finger. Perfect. Okay. And then at this point is when you would clean the lens.
Okay.
Okay. So you would put it in the lens in the palm of your hand with 3 to 5 drops of the solution. And then you would rub it for 10 seconds in a back and forth motion for 10 seconds on each side.
You want to stress that they never rub it in a circular motion because that could damage the lens.
Okay, so never rub in a circular motion because that could damage the lens.
Okay.
Okay. Okay, and then you're just going to, for 5 seconds, just with the lens or
Rinse it.
rinse the lens for 5 seconds with the solution, and then insert it in the case. And make sure it's the right.
And remember telling her that in the morning when she puts the lenses in to dump the case out, rinse it out with the solution, leave the caps off and let it air dry.
Okay.
So at nighttime when she takes her lenses out, she's going to need to refill it with fresh solution,
Okay.
about 2/3 full. And that she never wants to top off solution or reuse solution because it loses its effectiveness. Okay, and how long does she need to leave the lenses in the case for them to be properly disinfected?
4 hours.
Right, 4 hours to overnight.
To overnight, yes.
And if she's not wearing her lenses, how long can they stay in the case before she would have to clean and disinfect them again?
30 days.
Okay.
Then you would definitely want to make sure that you clean them. Change the solution, clean them, and put them back in the case.
Okay.
Okay, and how many hours is she going to wear her lenses today?
4 hours. And then add 2 hours each day until you're up to 8 hours of wear a day.
And when is she going to come back?
You'll come back in a week for a follow-up visit. Make sure you bring your solution and your case and your glasses, a backup pair of glasses.
And how long should she have the lenses on for when she comes in?
You should have your lenses on for at least 4 hours when you come in for your follow-up visit.
Okay, good. And just, no, that was great. There's a lot of information on these sheets, and it takes several times before you're really going to feel comfortable with it. So really, studying the sheet, practicing, more role playing, and after you've done it several times, you won't even have to refer back to the sheet. You'll think of all the different steps, and it'll flow smoothly for you. Not my words, but your words.
Okay.
All right. So think about what we've done here for a minute. What part of this seemed difficult, or how do you feel about the process?
I feel good about the process. What are the? Do we send the patient out with a type of follow-up?
Yes,
like
we have a
or something?
similar list for them
Okay.
of printed instructions, and we're also going to direct them to the manufacturer's website where there's additional videos that they can view if they forget some of the steps of care and handling and so forth.
Okay, perfect. Okay.
Okay. Any other questions?
No.
Great. Well, I think you're well on your way to teaching people how to care for their lenses.
Thank you.
Good job.
Mhm.
Reflection is where the mentor encourages the mentee to review their performance on a competency. The mentee should think about what has worked and what didn't work. They should also consider what they need to do next to improve their performance. For example, the mentee is asked to reflect on the soft lens delivery process they just performed. Following reflection, the mentor needs to encourage the mentee to communicate their findings. As the mentee articulates their perception of their performance on a competency, the mentor can agree or provide additional suggestions. For example, in this case, the mentee should talk about which steps of the soft lens delivery process were difficult for them to perform. Exploration involves giving the mentee room to solve the problem on their own. The mentor slowly withdraws some of their support, coaching, and scaffolding, and allows the mentee to perform the competency on their own. The mentee begins to solve their own problems. Thank you to Hillsborough Community College, the Opticianry Summit, the American Board of Opticianry, the National Contact Lens Examiners for their support of this video.